Welcome to the Parkinson's Project podcast. The Parkinson's Project seeks to erase the stigma associated with Parkinson's disease while empowering and inspiring those dealing with the affliction to live life to the fullest. The Parkinson's Project aspires to build an engaged, supportive community while examining the journey of living with Parkinson's disease through a positive, empowering perspective. Here is your host of the Parkinson's Project podcast, Tim McNiff.
Hello, everybody, and welcome back to the Parkinson's Project podcast. Part of the mission of the Parkinson's Project is to use first-person experiences, expert analysis, and cutting-edge information from the field of medicine to empower and inform people about the work that is currently being done and to drive research and innovation for new and better methods to combat PD. With that in mind, it is my great pleasure to welcome Dr. Paul Tuite. Dr. Tuite's a neurologist who treats adult patients with Parkinson's and other movement disorders at University of Minnesota Health Clinics and Surgery Center and University of Minnesota Health Clinic in Maple Grove. Dr. Tuite, I know you're a busy man. I want to thank you for making time to take part in the Parkinson's Project.
Thank you, Tim. Proud to be here.
This is new for me, and I have heard your name so many times in the short period of time that I have been involved with this, and I want you to know, always in good stead. Okay, so you come very highly recommended. I look forward to getting to know you, but I'd like to start, if I could, with a little bit of background. You decided to go to medical school and become a doctor. Was neurology the area you were always focused on? And if so, why?
So actually, it started in high school. I worked with a neurosurgeon from my hometown. He was specializing in brain tumors, Ed Newelt, who went on to develop Parkinson's himself. And so that was my first exposure back in high school, working on animals and cells, learning how to treat brain tumors. And then in college, I got exposed to some great neurobiologists, neuroscientists, psychologists. And then in medical school, Karen Roos and Bob Pascuzzi, who are a dynamic duo at Indiana University, institution to the south. And they were very inspiring. And I was one of two students that ended up going to neurology out of my medical school class, which was not very many. So you get mentors, they inspire you, you go your way into fields you never thought you might go.
So maybe going all the way back to that high school experience, so that was something that touched you personally.
Yeah, I mean, I knew I didn't want to be a surgeon at that point. I have great admiration for neurosurgeons, but I realized soon thereafter, this is tedious, tough work on your feet all day. I was like, okay, let's be smart about this. Let's do work with the brain, but not where, these lead aprons and whatever you're wearing in the OR, you're trying to not get too exhausted.
I had some prepared questions. I want to modify this next one because I think you somewhat answered it. I was going to ask you, did you intentionally move towards helping people with Parkinson's disease, or did the number of people being diagnosed with PD just sort of naturally pull you in that direction?
So my first exposure with someone with PD was the Assistant Attorney General I took care of way back. And I realized we could do a lot more for Parkinson's back then. And no one seemed to know about surgical treatments. And those are an area that's changed in the past few decades to help people. I did my training in Indiana, and I changed my residency to McGill, the Montreal Neurologic Institute, interestingly established by a man from North Hudson, who Wilder Penfield set up the first neurologic institute in North America. So I did my training there at McGill, and then Toronto was where I did my fellowship. And when you're in a residency, you're not sure what you want to do, what part of neurology, and there wasn't much Parkinson care in Montreal at that time. And Toronto was really the hotbed and for Parkinson work. And I said, I don't know much, let's go learn. And I learned quite a bit. And that preceded my arrival in Minnesota in '96. I was there for 2 years in Toronto.
What brought you to Minnesota?
When my father got his PhD back in the 50s, he was a New Yorker living in the dry town of St. Paul. and he and his young wife had to smuggle beer into their apartment. He wasn't a big drinker, but he was Irish, so you had to play the stereotype, when he was working on his PhD. And I felt like this was a great institution. He ended up teaching at Purdue, where I grew up in West Lafayette, Indiana, and always felt like Minnesota was a special place.
So your father was in academia. Was he also a doctor?
He was a PhD botanist, plant pathologist. So corn was his and fungal infections was sort of his expertise. And as you might know, that all these pesticides that are being sprayed on fields have a direct link to Parkinson's. He developed leukemia, where 3 other people in his group had, and those were probably from toxins they were all exposed to.
Okay, so I am a new arrival to this whole scene. When I was asked to participate in this, I asked, do I need to have previous experience? Because I really don't have any. So this journey for me has really been about discovery. And I've seen people kind of tiptoe around that subject. You're the first person I've heard and say in definitive terms, direct cause and effect, pesticides and Parkinson's.
Yeah, direct is always a tough call in science, and for veterans, there was a Minnesotan who led to VA or veterans who had been in Vietnam exposed to Agent Orange. They get service-connected benefits. So that legal sort of establishment of the connection of toxins and Parkinson's, it was a little bit of a jump from the science to actual policy implementation. So I think there's enough there to know that, there's things that we probably shouldn't get exposed to. And if we can remove them or not use them, we'll be better off. And there's a book called Curing Parkinson's that a Rochester neurologist in New York wrote. And so I think those are the goals are to kind of reduce the future reduce the incidence of Parkinson's for future generations.
Well, that's what this program and this podcast is all about, trying to facilitate. So this is a wonderful opportunity. I've heard it said in my short experience here that no 2 people experience Parkinson's disease the same. Is that true? And if so, what are the commonalities that you see when you're trying to treat them?
So it's always a yes and no in medicine. We never answer the question. Maybe that's a law as well. But everyone is on a path. I mean, it's sort of the issue. There was a great essay written in the New York Times about cancer, how if you have cancer, everyone wants to tell you what to do. They'll give you all sorts of advice, and then you have to kind of ignore it and do what you want to do, right? I mean, we're all individuals. We established our behaviors decades. It's going to be hard to change those habits. Some are good, some are bad, but that's sort of the piece that I try to play is, I'm not here to change that person. I'm here to help them adapt with their journey, their path. And, that's the piece that people need to realize is that we're all sort of on this journey. I think it was Warren Zevon who, yesterday, 2003, when he died, he had a saying like, enjoy every sandwich. So with COVID, we better enjoy every sandwich, it may be our last. So I think that's the value of COVID. It focused us to reframe the world as, where are we today? Let's enjoy today, Tim, you and I, make this podcast fun and go from here.
I'm already having a great time. I did not expect to hear Warren Zevon brought up in this podcast today, so you've already made my day. Okay, we're talking about dates. It was 30 years ago already that actor Michael J. Fox, who was at the top of his game at the time, came forward to tell the world that he had Parkinson's disease. That revelation put PD front and center, if only for a period of time. While you never wish a serious affliction on anyone, what did having a Michael J. Fox come forward and say that he was going to fight this thing with everything that he had do in terms of raising both awareness and funds when it came to research? So
I'm going to take that piece, which is very important, to say, where are we now? And where we are now is the waves of fads and trends. So NIH, or National Institute of Health, is funding a lot more for Alzheimer's disease, which is linked to Parkinson's in some ways, not directly, and the funding for Parkinson's is actually lessened. And so while without Michael J. Fox, we wouldn't be where we are today. I think we still have a lot more work to do, which is leveraging private and government foundations funding and getting the public to get back on board and keep the focus on helping people with Parkinson's. So it's an everyday battle that we do to grab the public's focus and interest in the field. So it's been helpful, I would say, absolutely. It gives a face to Parkinson's that wasn't there before.
In my brief tenure with the Parkinson's Project, I have heard more than one Parkinsonian say, Parkinson's isn't a death sentence. It's caught my ear, it's caught my attention. Part of your job is you have to give people bad news. What do you tell people when you're faced with having to tell them that they have PD?
Yeah, it's not easy, and often we struggle to do it in a humane fashion. I've more than once you hear the story of someone being told they have Parkinson's, and it just doesn't seem to be done in a humane fashion, and we all can do better. I think I often want that person to have someone with them. There's more than once. There'll be someone in the room by themselves, and I'm looking, is there a family member in the waiting room? Can we reschedule a meeting in a week? I can tell them the diagnosis, but I want them to come back so we go over it again. It's the shock of that initial few words that just their brain shuts down. And so we try to help them through that process to see what it means for them, and then tell them we're with them on the journey. We're all on this. I use that word over and again. It's a path. We're all living life. Our lives will end at some point. We don't know when, usually, and so we're there to help them.
I had an opportunity to interview a remarkable young man by the name of Jason Kopass, who I think you might be familiar with. And he told me the story of getting his diagnosis and going back to work. He just didn't expect it. And so there he was trying to process this whole thing. And, Jason's not going to cut a vein for you and tell you a lot of things about what he was thinking or feeling. But, he just said, well, I went out and threw out got out the treadmill, dusted it off, and got to work. But it's got to be a difficult thing, and I like the way you said, we should be more humane in how we deliver that news, because while not a death sentence, it is something where people are going to have to make major changes.
Yeah, well, I think the other important point is that too many times you hear the story how the doctor said something and the person keeps it in their mind, and that changes their view of the world. It's like you're with here today a few minutes, or you're in the office a half hour. Carry on with your life. Don't let me change your life. Find things you enjoy, do them, get out and exercise, get out and move. Those are the things we try to inspire, is not to focus on what we're saying or those sorts of things.
We're going to take a brief break to thank those who make the Parkinson's Project possible. Dr. Paul Tuite is a neurologist who treats adult patients with Parkinson's and other movement disorders at the University of Minnesota Health Clinics and Surgery Center and the University of Minnesota Health Clinics in Maple Grove. We'll be back with more in a moment. Again, I'm just going to start again right now.
Okay.
Welcome back to the Parkinson's Project. We're speaking with Dr. Paul Tuite from the University of Minnesota. Dr. Tuite, if PD presents itself differently in each and every person, I have to believe that every neurologist must approach their treatment as an individual as well. What kind of approach should a patient of yours expect from you?
My approach is to try to find that person, find where they're coming from, find what makes them them, and work with them. That's, and as today, you summarize what I'm going to say here is that there are no perfect words of wisdom, no guidance. It's just trying to find that person's philosophy. How do they want to approach things? We want them to exercise, but we also want them to do something they like. Some people don't want to be on a treadmill. They may want to just garden or do anything. We're here to kind of motivate them, nag them a little bit, but try to find them a strategy or approach that suits them.
Wonderful. Caregivers. Caregivers are so vital in helping Parkinsonians negotiate this new world. What can you say to or about caregivers and the role that they play in dealing with PD?
it can be very challenging. It's like being a parent 24/7, but it's often your spouse, and you have to respect the boundaries of that person who has Parkinson's, but also you want them to be healthy or fit or active as possible. So it definitely is a struggle of dealing with that aspect of, you as a caregiver, you may know what's best. That person may not be following their what could be most helpful for them. So I find there's a lot of internal turmoil that person may experience, and it's good to get that expressed. Maybe they need a therapist, or be able to talk with me or other parts of our team just to kind of vent, because it's not easy. And I feel for them every day when I see caregivers come in, and I want people to have a caregiver or someone to be their advocate. It really does help care. When you show up in a doctor's office and you have someone with you, you get better care. They help you remember, they help you keep on track what's going on, what you should be focusing on. We behave better, I think, as physicians, I think, when my 92-year-old mom goes in for her eye injections for her macular degeneration, you get better care when the son shows up, and I'm quiet, but make sure that gets done.
Have that second set of eyes. It always helps. You have been described to me as a great motivator. And I want to tell you that one of your patients told me you want to do well for him. What do you think when you hear that?
I'm honored to be that person for them in their life. I want everyone, what I would like for myself, to reclaim some joy, find some happiness. I want them to be the best they can be, help them along. I find that's my role. It's a privilege to be a physician, an honor. We don't always do it right or the best we can, but we try. So that's what I try to do my best.
One of the things I've learned is that there's a stigma attached to the PD diagnosis, and I didn't expect that. What do you want people who are struggling to come to in terms with their PD to know, or perhaps to get out of this interview, if they're hearing you for the first time?
Yeah, PD represents one of many movement disorders. So these are things that we see. It's a visible condition. So unlike, say, cancer, you can see it. And so as children, when we're growing up, we stare at people that are different from us. So I think that's sort of what sets Parkinson's disease apart from other medical conditions. It's visible, and therefore stigmas can be attached to someone who appears different. And for everyone who's had, grown up being different, these can be isolating. And so it's the challenge of feeling isolated or feeling that stigma and trying to deal with it in whatever way works for that person. It's an opportunity to educate the public about Parkinson's if one finds that appropriate. I have several patients that are physicians that haven't disclosed their diagnosis. Other young people that are 30 or 40 haven't disclosed their diagnosis beyond their family. It's not the time for them. Michael J. Fox delayed for many years till he disclosed the diagnosis. So I think at some point when you have to come to terms with that whole psychological aspects of the disease. How do I deal with this? Do I ignore it? Do I live, it's difficult.
I want to return to that. You just said, I did not know this. My assumption was always that, Michael J. Fox, something was there. He went to the doctor, found out he had this, and he came forward and did this. But so I guess as you've seen the progression of the disease, the more likely scenario is that he probably knew that he had something for quite some time, or at least a period of time, before he revealed it to the rest of the world.
Yeah, so his essay he wrote was when he first developed tremor of his left pinky. He was in his 20s, and he went to the University of Florida, and they said, oh, it's just tremor. And because that's probably all he had at that time, he didn't have much slowness or stiffness, the other cardinal features of Parkinson's. So it took a period of months or years till ultimately the diagnosis was made, and he opted to get a brain surgical treatment to eliminate his left-hand tremor. So, and he probably had pretty good symptomatic control with a combination of medication and that surgery, so that no one would really know his diagnosis. And over time, it probably became much more obvious as he started to have the involuntary movements that are often associated with medication therapy. So those are called dyskinesias. So I would suspect that's when he disclosed to the public and decided to create the foundation, try to be advocate, try to go down that path of changing care for everyone.
If you and I were to have met each other at a dinner party or some sort of a function, and we introduced ourselves, and I said, "What do you do?" You said, "What do you do?" We talked about that, and I asked you about Parkinson's disease, and if I said to you, "What is one thing that I should know right now as an ordinary citizen about Parkinson's disease, or should I pay more attention to it, or should I care more? How would I help?"
Wow, didn't expect that question. Donate.
There's always that, right?
University of Minnesota, there you go. We have plenty of opportunity for you. You can volunteer as a healthy control. There's lots of opportunities to make a difference there. We're always looking for people that do not have Parkinson's that want to participate in a brain MRI study. Lots of spouses do that. I think of PJ Fleck, the football coach, honoring the nurses recently at the football game. Just those sorts of things, of lots of opportunity, respecting the providers, the social workers, the nurses that do things for people with Parkinson's, and no one acknowledges their work. It's the doctors that often get the credit, but it's the people in the trenches that do the, helping comfort those people, the care providers.
If we haven't learned that during the COVID crisis, then we haven't learned anything at all, right?
That's right.
Yeah. So I did go off script, and I apologize for that. And if I took you somewhere you didn't want to go, I apologize for that too. But part of what I want to do is I want to see how we can bridge the gap, how we can get this into a conversation with people who aren't necessarily dragged into this community, but maybe engage in a way that will be productive for both. So in this final question, in your opinion, you may have touched on this earlier, but I'll come back to this again. In your opinion, where are we in terms of medical advancements or not in the treatment of Parkinson's disease?
So COVID put the pause button on a lot of the research. There's things are restarting. We've got some interesting things that I think are helpful. There's lots been written about the brain and the gut. We're interested in that part of Parkinson's, maybe transforming the gut bile acids by giving supplements that may reduce inflammation of the gut, that may impact the brain. The New York Times had an article this week. It was an older article about how athletes have different gut bacteria that lead them to metabolize products different, and probably leads to their better athletic performance. So that's one area we're interested in pursuing. My colleagues, Colin McKinnon, is leading a project, high intensity treadmill therapy. We know exercise is good. We just don't know what type of exercise is better. And so that's something that's really exciting. It's a multi-center trial that's starting. A diabetes drug is going to be used, is in studies to look at, and we're one of several centers, to see if it can reduce inflammation. There's lots of work at the University of Minnesota. We're a Udall Center. It's a federally funded Parkinson Center. We're doing deep brain stimulation research, lots of improvement in physiology of the brain. How do we treat the changes in brain physiology with electricity? So all the various device companies in town are interested in helping out. So there's a fair amount of things that are happening. We still don't know what to make of stem cell therapies, what to do with gene therapies, all these things that potentially some of the new vaccine technology might be usable in Parkinson care.
Well, Dr. Tuite, I want to thank you for your time and your insight. And I want to thank you for the work you're doing on behalf of the Parkinsonians. This was a great opportunity for me to learn a little bit more about this. And I know I went off the page a little bit a couple times, and I appreciate you and your patience in following me.
Thank you, Tim. There is no page. There is no script. We're just every day finding something new, and hopefully that'll lead to a cure. That's how we found penicillin. We found all these the deep brain stimulation therapy was, someone said, let's put a pacemaker in there and see if it works. So you got to be creative, got to think outside the box, and enjoy every sandwich, as they say, Warren Zevon.
Enjoy every sandwich. Dr. Paul Tuite is a neurologist who treats adult patients with Parkinson's and other movement disorders at University of Minnesota Health Clinics and Surgery Center and University of Minnesota Health Maple Grove Clinics. We thank Dr. Tuite for participating in the Parkinson's Project. The Parkinson's Project is an experience that's trying to use first-person experiences, expert analysis, and cutting-edge information from the field of medicine to empower and inform people about the work that's currently being done to drive research and innovation for new and better methods to combat PD. Thank you, and we'll see you right here next time on the Parkinson's Project.
Thank you, Tim.
Thank you for engaging with the Parkinson's Project podcast. Be sure to look for more content on the Parkinson's Project Facebook page, and we'll see you right here on the next edition of the Parkinson's Project podcast.